everyone, it's Dr. Nikki, the board certified family nurse practitioner, back again with another health topic. Today, I will be talking about anemia. Anemia is a blood disorder. It's very common. A lot of people suffer from anemia. We have different types of anemia. We have iron deficiency anemia. We have hemolytic anemia, we have aplastic-anemia, we have pernicious anemia, we have anemia of chronic disease. All right, so as I said, anemia is very common. It's important for you to know if you suffer from anemia so that you can get the appropriate treatment and feel better. Okay, so let us get started. We'll talk about what causes anemia, how you can find out if you have anemia, the types of anemia and the signs and symptoms of anemia, and then the treatment options. So when anemia occurs, your body makes too few red blood cells, all right, or destroys too many red blood cells or loses too many red blood cells. Those are the three things that could be happening if you have anemia. As I said before, anemia is a blood disorder. Red blood cells contain hemoglobin. It's a protein that carries oxygen throughout your body. If you do not have enough red blood cells or the amount of hemoglobin in your blood is low, the body doesn't get all the oxygen it needs. And as a result, you may feel tired or have other symptoms such as faintness or dizziness. You may have shortness of breath. You may get pale skin. You may have leg cramps. You may have heart-related symptoms like a murmur or abnormal heartbeats. You may have a weak or rapid pulse or rapid breathing. So as I said before, if you notice any of the signs and symptoms, you should please consult with your primary care provider. All right, so let's talk about diagnosing anemia. Once you know that you have any symptoms, any of the symptoms that I mentioned, you can go to your doctor and let your doctor know. They will do a physical examination and then they will do some blood tests. All right, so they can determine if you have anemia through blood tests. And then some people find out that they have anemia if they go to their doctor for other reasons. So along the way, you might go to your doctor for one thing and then find out that you have anemia when they're doing a workup for that particular thing that you went to the doctor for. So sometimes it's incidental findings for some people. All right, so your doctor will also ask you about your medical and your family histories, do a physical exam as I mentioned, and do some tests and procedures to find out whether you have anemia, what is causing it, and how severe it is, and then they will determine what the plan of care will be for you. All right. The main goals of treatment are to prevent complications of the anemia, such as heart or nerve damage, to relieve your symptoms and improve your quality of life. Remember, I said you want to be better. You want to feel better. All right. And then treat the underlying condition if the condition is causing you to have anemia. And of course, we want to raise your red blood cells and your hemoglobin levels to improve your blood's ability to carry oxygen. All right? So let us talk about the specific types of anemia. We'll start off with iron deficiency anemia, and then we'll go from there. So iron deficiency anemia, the people that are, increased risk for iron deficiency anemia are people who have certain diseases or conditions such as Crohn's disease, celiac disease, or kidney problems, people that have internal bleeding like ulcers, people that do not get enough iron from their foods, and then infants, children, pregnant women, and also women of childbearing age and adolescents. They are, increased risks for iron deficiency anemia. All right, so as I said, when you're going through growth, when you're an adolescent going through growth spurts or having blood loss due to menstruation or pregnancy, you may have iron deficiency anemia during those times. So it's important for you to eat the right amounts of foods that will help you. So iron supplements, dietary changes, eating foods that are rich in iron and vitamin C will help to increase your iron absorption from food. Okay? And then we have aplastic-anemia. Aplastic-anemia can the people that are at risk for aplastic-anemia are people that have diseases or conditions that damage the bone marrow, people that are undergoing chemotherapy or radiation, and people that are exposed to certain types of toxins or taking certain medications. And so pretty much the treatment depends on the cause of the anemia. It could include you getting medication, you getting blood transfusion, or bone marrow, stem cell transplants, and lifestyle and dietary changes, lifestyle changes. All right, and then we do have pernicious anemia. So pernicious anemia, we have B12 and folate, which is another type of B vitamins. They are needed to make healthy red blood cells. So you need to absorb these vitamins from food. So pernicious anemia occurs if your body can't make enough red blood cells because it can't absorb enough of the B12 from food. So we have people that have problems absorbing B12, and then people that do not get B12 from their foods or diet. So the treatment for that is just that you can take B12 supplements and make some dietary changes, eating foods that are rich in B12, such as dairy products, cereal, breads, eggs, meat, and other foods that are fortified with B12. Okay? And then the last one we have is hemolytic anemia. Hemolytic anemia, we see a risk group differ depending on the cause and type of hemolytic anemia. Red blood cells, they have typically a lifespan of about 120 days. So if your body constantly makes new red blood cells to replace ones before they die, so your body constantly makes new red blood cells to replace ones before they die. But technically, the lifespan of red blood cells are about 120 days. So sometimes the red blood cells are destroyed before their normal lifespan is up. Hemolytic anemia occurs if your body can't make enough red blood cells to replace those that are destroyed. Pretty much that's what it is. So acquired hemolytic anemia occurs if your body gets a signal to destroy RBCs, which is the red blood cells, even though they are normal. Okay? And so, as I said before, we do need you to get treated, diagnosed and treated. That's the goal. So they need to know what type of anemia you have and then the treatment. All right, so as I said, treatment depends on the cause of the anemia. Treatment may include blood transfusion, surgery, procedures, lifestyle changes, and taking medication. I also wanted to talk about another type of anemia, which is anemia of chronic disease. All right, we call it anemia of chronic disease or anemia of inflammation. It's a type of anemia that affects people who have conditions that cause inflammation, such as autoimmune diseases. We have people with chronic kidney disease or cancer. All right, so it's important to know the type of anemia that you have, because if you have anemia of chronic diseases, it's important for you to get the right type of treatment. Okay, all right. So treatment can include, being on supplements with iron, folic acid, B12. It could be a combination of things. All right, and then making sure that you go and see your doctor regularly. All right, and they need to treat the underlying disorder. All right, treatment of the anemia of chronic disease requires treating the underlying disorder. Okay, so as I said, the treatment could be, the anemia could be mild, it could be severe, so it depends. All right, and as I said, iron deficiency anemia, it's a very common one, and people just take iron supplements and they help them for the iron deficiency for that one. So, as I said, we have different types of anemia, and we do have possible signs and symptoms like I mentioned before. And I do need you to please follow up with your doctor if you feel that you have any of the symptoms, so that he can appropriately do a checkup and then some blood tests to determine if you have anemia, what type you have, and then the treatment options. So talk to your doctor, and follow your doctor's advice in regards to supplements that you're supposed to be taking if you do indeed have anemia, medicines, other treatment options, your diet. Make sure that you follow through. Visit your doctor regularly for checkups and ongoing care. Let them know if any new symptoms develop. All right, and then just make sure that you go for checkup regularly, and you should be okay. Well, I hope this helps, and I hope that you please share this episode with friends and family. Let them know that we talked about anemia today. Thank you so much for tuning in, and I'll catch you in the next one. Bye-bye.